This is the second recording for the Chapter 8 slides, and we went over the different movements, but these are special movements. Elevation and depression. You can pretty much, the examples are either with the jaw or with the shoulders, okay? So, elevation would be shrugging your shoulders, okay, because it's lifting, elevating. So shrugging your shoulders is elevation. So what would be depression of the shoulders would literally be the opposite of elevation, or depression of the shoulders would just be your normal position of your shoulders. Then depression would be opening your jaw or opening your mouth. That's going to depress your jaw. Elevation is just closed mouth. I know it's not in the notes, but if they're going to give you a shoulder example, I want you to know what the elevation and depression is. So shrugging your shoulders is elevation. Normal shoulder position is depression. And then opening your mouth is depression. Closing your mouth is elevation. And protraction and retraction are just with the jaw, just with the mandible. So when you stick your mandible, when you jut your jaw out, that is protraction. Retraction is like, it's not really the normal position of the mouth, but it's like you're pulling the jaw back towards your neck a little bit. So those are just mandible or jaw, lower jaw movements. Protraction and retraction. So we'll look at the picture. Here you have depression of the mandible, open mouth, and then you have elevation of the mandible, which is closed mouth. And then you have, that reminds me of being a teenager, but then you have the protraction of the mandible, and then you have the retraction of the mandible. All right, this is a table of the different movements. I'm not going to go over all of these different types of joints, but I will mention the hinge and then the ball and socket. Because your ball and socket joints are the shoulder and the hip joint, and then your hinge joints are the knee and the elbow. So, just for the sake of giving you some examples, the carpals, the wrist bones, kind of sort of move a little bit when you move your hand and your wrist, and that is a plane joint because they're basically two flat surfaces kind of sliding past each other. It's a gliding movement is what it is. Then you have the humerus and the ulna form the elbow joint, and also the joints of your fingers called interphalangeal joints. That's going to be your hinge joints, as well as your knee. Your knee is hinge joints. There's a saddle joint, which is where your basically the metacarpal bone that articulates with your thumb. And then where that metacarpal articulates with that trapezium, which is a carpal bone, a wrist bone. So you got a hand bone articulating with a wrist bone right here. All right. That particular joint, and that's only for the metacarpal that connects to the thumb. It's only for the first metacarpal. But that joint fits like a saddle, like if you're sitting in a saddle. So it's called a saddle joint. But the ball and socket is your hip and your shoulder joints. There are 5 main synovial joints. I know you've heard of TMJ, temporomandibular joint, which is where your temporal bone and your lower jawbone, called the mandible, where they connect. But it's your jaw joint, your lower jaw joint. And then your shoulder joint, elbow, hip, and knee. So they're the 5 main synovial joints. And I'm just going to point out mostly about the knee, but I will read through the homeostatic imbalance. So TMJ stands for temporomandibular joint. So dislocation of that is like dislocation of your jaw. And the reason that dislocation of your jaw is common is because the socket of the joint is shallow. And it's usually caused by grinding your teeth. The shoulder joint is called the glenohumeral joint, and it's the most freely movable joint in the body. You have the most movement, the most free movement at the shoulder joint. You can freely do rotation at the shoulder. You can do circumduction. You can draw a very, very large circle with your shoulder. I mean, with your arm, where you're using your shoulder joint. You can do abduction, adduction, flexion, extension, hyperextension. I mean, basically pretty much all the movements that we learned. In the shoulder joint, stability is sacrificed for movement. You have more freedom of movement, but the shoulder joint is not as stable, and it can get dislocated, especially during like sports. And the only thing I would say is just for the shoulder joint, just to know that is the head of the humerus fits into a cavity in the scapula called the glenoid cavity. And that's the main thing, that I would expect you to know. We will learn the rotator cuff muscles when we get to the muscles, okay? But I will tell you now, since it's in the notes, the rotator cuff muscles, they're called the subscapularis, the supraspinatus, the infraspinatus, and the teres minor. They're the rotator cuff muscles, and they help stabilize the shoulder joint. So we'll just learn it that way. Okay, the rotator cuff helps to stabilize the shoulder joint. I don't see it in the notes, but it does. And the other thing is the tendon of the long head of the biceps brachii muscle is a super stabilizer. So it also helps to stabilize the shoulder joint as well as the rotator cuff muscles. So that tendon, I'll show you. So this is the tendon, and it will attach to the biceps brachii, the long head of the biceps brachii. And that tendon greatly helps to stabilize the shoulder joint. And then also the rotator cuff muscles. The homeostatic imbalance is on shoulder dislocations, and again, the primary reason you have so many shoulder dislocations is that the shoulder sacrifices stability for movement. The elbow joint is a hinge joint. It only allows for flexion and extension. And I really don't have anything to add there, except just to know the bones that form it is the humerus bone and the ulna. For the hip joint, it does have good range of motion, but the range of motion is limited because the socket of the hip it's a deep socket, so the hip joint is much more stable than the shoulder joint. So looking at the hip joint, it's hard to see it from this view. Okay, here you go. This is the real thing. So this is the head of the femur, and the head of the femur fits into this cavity called the acetabulum. Let's see if we have that word. No, but it's called the acetabulum, and it's just a socket in the remember we were talking about this. It's actually part of the ilium, ischium, and pubis, but it has like a raised area, like a lip. It's called the acetabular labrum, and that raised area, so you can see it here. By having that raised area outside of that cavity, it makes the socket even deeper, so it makes the hip joint even more stable. There's not any ligaments that I care about you knowing, but there are in the knee. So the knee joint is the most complex joint of the body, and the knee joint allows flexion, extension, and a little bit of rotation when the knee is partially flexed, but it's not a lot of rotation. But there's a lot of ligaments that help to stabilize the knee. The ones that are inside here, inside the joint capsule, they're called the cruciate ligaments because they form a cross. There's the anterior cruciate ligament, or ACL, and then the posterior cruciate ligament, or PCL. And I usually tell this story. I had a dog years ago that had an ACL tear, and the vet, he fixed it with fishing twine. And the first surgery, he used a certain weight, of fishing twine, and my dog had to stay in a crate. He's a big dog. He's a big black lab, and he had to stay in a crate for 4 months. And you could take him out, but you had to hold him so tightly that he couldn't jump. So you could take him out, walk him around. He had to go back in the crate. It was horrible. I mean, it was just terrible. On me, on the dog, it was just, we all suffered because, he was miserable. Anyway, the minute that we let him go, he jumped on that knee and he broke that twine. So he ended up, long story short, he had that surgery 4 times. And the 4th time, the vet felt so bad, he didn't even charge me. But an ACL tear is bad. It's a bad thing. And it's a lot of times happens in athletes, football, soccer, basketball. It's very common to have an ACL tear, and sometimes it means the end of your career, and sometimes it doesn't. It just really depends on how bad it is. But those ligaments, especially the ACL, are easily torn, but they help to stabilize the inside of the knee joint. And let's see. You can see fat pads in the knee joint for extra shock absorption. You can see that it has bursa. There is a tendon. So the patella or kneecap is one of those bones, a sesamoid bone. And a sesamoid bone forms inside of a membrane. And in this case, it's inside of the tendon here. The tendon attaches the quadriceps muscle all the way to the tibia, to the front of the tibia. So in the middle of that tendon, the patella forms. And so the kneecap, the patella forms. There's a patellar ligament, which the tendon of the quadriceps is the same structure, but it's just called the quadriceps tendon above the kneecap, and it's called the patellar ligament below the kneecap. You can see those little wedges of tough cartilage, and that's the meniscus, lateral meniscus. That helps the knee joint to be more stable. Oh, and it's the patellar ligament that doctors are tapping to test the knee jerk reflex. So that's something that you might be asked about. All right. And here's another picture where you can see even more ligaments. So you can see the tendon of the quadriceps. You can see the patellar ligament because it actually connects the kneecap to the tibia. So it's a ligament instead of a tendon. There are like ligaments. This is called the fibular collateral ligament because it's on the lateral side of the knee, the outside of the knee, and it attaches to the fibula. And this one is called the tibial collateral ligament. But basically, all of these different, so many ligaments is just to make the knee joint more stable. The ACL actually functions, the anterior cruciate ligament actually functions to prevent forward sliding of the tibia and hyperextension of the knee. It prevents or stops hyperextension of the knee. And the PCL or posterior cruciate ligament, where the ACL prevents forward sliding of the tibia, the PCL prevents backward sliding. Common knee injuries, it says, involves the 3 C's, collateral ligaments, cruciate ligaments, and the cartilages or menisci. Twisting the ACL, like runners even, twisting their ACL. But the ACL tears are also common in, because it says, injuries affecting just the ACL are common in runners who change direction. So think about that. You're not just talking about runners. You're talking about soccer, basketball, football, and this is illustrating hockey, the hockey puck hitting the knee and tearing, what is this one? The ACL. Joint disorders, cartilage tears can be repaired with arthroscopic surgery due to compression and shear stress. Sometimes they'll remove part of the meniscus, which the joint will be less stable then, but more mobile. This shows you a tear in the meniscus. And then a sprain is when reinforcing ligaments are stretched or torn, either one. When ligaments are stretched or torn. So they can sew ligaments back together. The ends of the ligaments can be sewn back together if necessary. But as far as repairing themselves, they repair themselves very, very slowly. Dislocations can happen at any joint, really, but the shoulder especially. Subluxation is partial dislocation of a joint. There's bursitis, which is inflammation of the bursa, and tendinitis, inflammation of the tendon sheaths. Basically, you rest and you ice it, and you can use anti-inflammatory drugs like, ibuprofen, Advil. Arthritis is technically defined as inflammation of a joint, but there's osteoarthritis, rheumatoid arthritis, and then there's gouty arthritis, which we call gout. Okay, so osteoarthritis is the most common type, and it's more like from wear and tear. So course, most arthritis you're gonna see it more in people as they get older. But this is definitely, one that you see in older people more and more because, the older they are, the more wear and tear that they've had. But anyway, the cartilage is broken down faster than it's replaced, and it's more females than males, and it may cause your joints to be stiff. There's treatment, there's glucosamine, chondroitin sulfate, nutritional supplements, and a lot of people with osteoarthritis end up, having to have joint replacement. Rheumatoid arthritis is different. It is the one, like if you see someone who is like they've got some deformity because of their arthritis, it will change, it will actually cause deformity of their joints. So it's chronic, it's inflammatory, and it's actually an autoimmune disease. The immune system has started to attack your own cells. So rheumatoid arthritis is going to include joint pain and swelling, anemia, or low oxygen, osteoporosis, muscle weakness, and even cardiovascular problems. So there's more to it than the osteoarthritis. So that is rheumatoid arthritis, and they use steroids and also non-steroid anti-inflammatory drugs for pain and inflammation. I've even heard people. There's something that I've heard of people taking that's got gold in it, but I don't know enough to talk about it really. But anyway, they also can take immune suppressants to slow the autoimmune reaction, so it won't get bad so quickly. And of course, you can do joint replacement for rheumatoid arthritis as well. And this is what I meant. Like rheumatoid arthritis is the one where if someone has it, you know it because their joints are swollen and they're deformed. It deforms them, their hands, their arms, knees, ankles. Then I just call this gout, but gouty arthritis is deposition of uric acid crystals in the joints. And a lot of times you see this in the big toe. And it's not just, I know that it's associated with alcoholics, but it's not just people who drink alcohol. It is more common in males. And it is very painful at the great toe or big toe. And the treatment is drugs, plenty of water, avoiding alcohol, and it says foods high in purines such as liver, kidneys, and and sardines. And I would say even I know for a fact that you can eat just raw plain cherries. Cherries are really, really good. I've known people who treated their gout just by eating cherries. There's something about, I guess cherries would be high in purines also. Lyme disease is from a bacteria that is transmitted by a tick. But the reason we have it in this chapter is because it can lead to joint pain and arthritis if it's not treated. I also had dogs that got Lyme disease, and that was just weird. But they came in the house and laid on the floor, and they wouldn't move. I mean, all they could do was lay around. These are active dogs. But antibiotics, and because it is it is transmitted by bacteria, so you treat it with antibiotics, and they were treated with antibiotics and they got over it. And that will be it for our chapter 8.